Hi everyone, welcome to Pharmagist. Myself Dr. Haimavati. In today's video, we'll be discussing about the drugs affecting the cardiovascular system. Under this, we will study about anti-hyperlipidemic agents. So, anti-hyperlipidemic agents are the drugs which are used to treat hyperlipidemia. So, what is hyperlipidemia? Hyperlipidemia is nothing but uh, in general name we can call it as obesity. So when we eat unhealthy foods and junk foods, foods containing fat rich foods like these burgers, pizzas, which contain high amounts of fats like cheese, different kinds of cheese, what happens? Lipids are accumulated in the body and we get a condition known as obesity. So here is a small joke to understand the current situation. That means God makes all the things which are tasty as unhealthy, and He is laughing at the things that we are eating all these unhealthy foods and we are becoming obese. And some of our friends may feel that this food it won't fill the void in your heart. But we as a person of science, we know what happens if you take unhealthy foods. So the unhealthy foods they cause a lot of disorders. So what are those disorders? We'll be seeing. So this is the normal artery. So when you see the blood supply throughout the body in a healthy normal artery, what happens? So you can see it is clear. But when you are eating fat rich foods, what happens? The lipids they get accumulated along the walls of the arteries, and slowly they keep on accumulating until the entire artery becomes narrow. See, you can see they keep on depositing. So when you see the cross section of this artery, you can see these lipids, they are accumulated along the walls and they form a plaque. And this plaque obstructs the flow of blood. So when it obstructs the flow of blood, what happens? A number of disorders will be arising. So now let's see the definition of hyperlipidemia. What is hyperlipidemia? It is a term used to describe elevated, that means increased plasma levels of lipids in the body. So lipids are in the form of lipoproteins, and this accumulation of lipids or lipoproteins leads to the development of atherosclerosis. So atherosclerosis is a severe fatal disorder which leads to death of the patient. So that is why we have to study about this hyperlipidemia and how to reduce it, or what are the different drugs used to treat this hyperlipidemia. So these lipoproteins, they are macromolecules which consist of cholesterol and triglycerides. They are generally spherical in shape. And these lipoproteins, they are classified into 4 different types. The first one is very low density lipoproteins, that is VLDL, and then intermediate density lipoproteins. Then we have low density lipoproteins and high density lipoproteins. So out of all these high density lipoproteins are beneficial to the body. That means they are good to the body. All the other, so this VLDL, IDL and LDL, these proteins are harmful to the body, which leads to accumulation of the lipids in the walls of the arteries and lead to atherosclerosis, thrombosis, etc. So where do these lipids come from into the body? So the first source is the diet, that is the food we eat. So as I previously mentioned, when you are eating fat rich foods, what happens? These fats they enter into the body. And the second source of lipids is the endogenous synthesis. That is the liver which is present in the body. It synthesizes cholesterol from the food we are taking. Next, how many types of this hyperlipidemia are there? So this hyperlipidemia is also known as hyperlipoproteinemia. So there are different types based on the different levels of LDL, triglycerides and the chylomicrons which are present. So these lipid disorders, they are related to problems of lipoprotein metabolism. So when the lipoprotein metabolism is decreased due to any condition, it leads to this condition known as hyperlipoproteinemia. and it is classified into 6 types. So we have type 1, and in type 2 we have 2A and 2B, type 3, type 4 and type 5. So total we have 6 types of this hyperlipidemia or hyperlipoproteinemia. So the first condition, which is known as type 1 hyperlipidemia, is because of decrease in the levels of lipoprotein lipase. So this lipoprotein lipase is essential for the metabolism of the lipoproteins. So when the activity or this function of this lipoprotein lipase is reduced, it leads to this type 1 hyperlipidemia. And in type 2 we have two types, 2A and 2B. In type 2A, the levels of LDL, so that is the low density lipoproteins, and increases, but the level of triglycerides is normal. Whereas in type 2B, both VLDL, that is very low density lipoproteins, and low density lipoproteins, so these levels will be very high in the body. And in type 3 is a rare disorder. So in this we have increased LDL, that means low density lipoproteins. And then we have type 4 hyperlipidemia. In this there is increased levels of VLDL and triglycerides. And in type 5 there is high amounts of VLDL and chylomicrons in the body. So you can see in the different disorders there is only one minor difference. That means in type 1 there is a decrease in lipoprotein lipase. Whereas in type 2 you have two types. In the first type there is increased levels of LDL, and in type 2B both VLDL and LDL are increased. In type 3 there is only LDL increase, and it is a rare disorder. And in type 4 we have increased VLDL and triglycerides, and in type 5 you can see there is VLDL and chylomicrons. So in these 6 types, the type 2 and type 3 hyperlipidemia are familial disorders. So what is familial disorder? So familial disorder is nothing but, suppose you take a parent, so the father and the mother. So if the father is having this deficiency or this disorder of hyperlipidemia, then what happens? So if they are having 4 children, so out of these 4 children, any two are, so out of these 4 children, any two of them, if there are 50-50 chances, there is a probability that 2 children may get this familial hyperlipidemia, and the other remaining 2 children, they may be healthy. So if either even one parent is having, it gets inherited into the children. So, so now let us see what are the different hyperlipidemic agents. So we have 3 classes of drugs: the statins, the fibrates, and the bile acid sequestrants. So now let us see the mechanism of action of these statins. So the statins, what happens? The cycle starts with the acetyl-CoA enzyme which is present in the body. So this acetyl-CoA is converted into acetoacetyl-CoA, and which is further converted into HMG-CoA. HMG-CoA is nothing but the 3-hydroxy 3-methyl-glutaryl-CoA, so shortly known as HMG-CoA. So this HMG-CoA is converted into the mevalonate, and this mevalonate is ultimately responsible for the synthesis of cholesterol. So here this step is the main step, that is the synthesis of mevalonate from the HMG-CoA. So this step is brought about by this enzyme which is known as HMG-CoA reductase. So if this HMG-CoA reductase enzyme is present, then only this HMG-CoA can be converted into mevalonate. So it is the rate limiting step in the synthesis of this cholesterol. So this statin class of drugs, what they do, they inhibit this HMG-CoA reductase enzyme. So when they are inhibiting this enzyme, what happens? So this HMG-CoA cannot be converted into the mevalonate, and then the cholesterol cannot be synthesized. So in this way, all the statins act. Now, what are the different drugs that are used as statins? So we have lovastatin, we have simvastatin, mavastatin, atorvastatin, fluvastatin, and then serivastatin. So we have six drugs which are used as statins. So all these, they work by the same mechanism of action. Now coming to their uses. So they are used in the treatment of hypercholesterolemia, hypercholesterolemia, and also in the treatment of hyperlipidemia, familial hyperlipidemia, that is the type 2A and type 2 hyperlipidemia. The side effects. So when you're taking these drugs, what happens? There will be GI disturbances, constipation, flatulence, and we have another rare side effect which is known as rhabdomyolysis. So this rhabdomyolysis is a massive muscle necrosis with secondary acute renal failure. So this happens when you're taking these statins with other class of drugs like cyclosporin, which is an anti-cancer drug, and fibrates. So these are also lipid lowering drugs. So when you're taking the statins as a combination with other class of drugs, we have to be very careful. Otherwise, the serious side effect of rhabdomyolysis may occur, and this rhabdomyolysis, it leads to death of the patient. So these are the main side effects of statins. Now the next class of drugs is the fibrates. So these fibrates, they act by activating the peroxisome proliferator activated receptor, shortly known as PPARs. So they stimulate these receptors, and they also stimulate the lipoprotein lipase. So the enzyme which is responsible for metabolizing the lipoproteins present in the body. They also inhibit cholesterol biosynthesis prior to the mevalonate formation. That means they also have the effect in the biosynthetic pathway of cholesterol biosynthesis. So fibrates mechanism of action is they are activating the peroxisome proliferator receptors, and they are stimulating the lipoprotein lipase, and they are also inhibiting the cholesterol synthetic pathway. And what are the drugs we used in fibrates? So we have clofibrate, ciprofibrate, zemfibrozil, and fenofibrate, and also benzafibrate. So we have 5 drugs: clofibrate, ciprofibrate, fenofibrate, gemfibrozil, and benzafibrate. So these are the drugs which are used in the treatment of hyperlipidemia. Now coming to their uses. So clofibrate is the drug of choice in the treatment of type 3 hyperlipoproteinemia and also type 2A and type 2B hyperlipoproteinemia. And now coming to the side effects of fibrates. It is cholelithiasis, GI disturbances, eosinophilia, and pruritus. So cholelithiasis means obstruction of the bile juice. So this is the main side effect of these clofibrates. Next we have bile acid sequestrants. So these bile acid sequestrants are anion exchange resins. So these they selectively bind and exchange the negatively charged atoms or molecules with one another. For example, so we have a drug known as cholestyramine. So in this cholestyramine, what happens? Chloride ions are present. So the chloride ions which are present in the cholestyramine, they are exchanged with the anions of the bile acids. So bile acids also have the cholesterol structure. So they bind with the anions present in these bile acids and exchange the chloride ions instead of these anions. So here these bile acid sequestrants, they bind to the glycocholic acid and taurocholic acid and increase their excretion. As a result, what happens? The levels of cholesterol. So I hope you understood that concepts well, and if you like the video, do not forget to like, share and subscribe to my channel. See you in the next one. Now coming to the uses, they are used in the treatment of hypercholesterolemia which does not respond to dietary modifications. So previously we have seen the other two classes of drugs. So these drugs they are given along with dietary modifications also. That means the patient is suggested to reduce the intake of the fat rich foods. But here in this condition what happens? So even if you are reducing the fat intake, if the lipid levels are not getting reduced, so in that conditions we use this bile acid sequestrants. So what they do? They reduce the cholesterol levels by binding with the bile acids, and they are also used in digitalis toxicity and overdose. The side effects of these drugs are constipation, bloating, and hyperchloremic acidosis.